So, greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. And as always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. So, here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I am very, very pleased to welcome Joe Harrison out of New York, USA. And Joe is a trailblazer. He says dedicated to making a difference in healthcare. And he has with a decade of experience leading behavioral health initiatives for value-based care health plan. Joe shifted his focus to building a digital health company that partners with health plans and ACOs to improve outcomes for adults and seniors with chronic medical and behavioral needs. And Joe is an advanced registered nurse practitioner specializing in primary care, geriatrics, and behavioral health. So welcome, 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 Joe.
Thank you, Dale.
Tell me why you became a nurse.
I think it's probably I have a lot in common with so many nurses. I've always delighted in helping people, and when I was younger, I did a couple of different things before I decided to enter nursing. I worked in the hospitality industry, and then I became a teacher. And so I was an educator, a secondary school educator. And I actually experienced burnout as a teacher. And I was working in an area with very high needs, a lot of social determinants, a lot of inequality.
Yeah.
And my students were being, traumatized and experiencing incredibly adverse early life. And the schools that I was working in were very low resourced, and I just felt like I was in an impossible situation. I was asked to do more than I could do effectively, and I didn't have the supports and the resources that I needed to actually, really do right by the kids. And the chronic stress and the feelings of sort of inadequacy really demoralized me, and I had to stop. I just knew I couldn't go on, but I didn't want to stop helping. And so I looked out at my options and I realized, and I think I want to say something about gender here too, because, you know, nursing is highly associated in the United States with females
Females.
because the majority of nurses have been females since the beginning of nursing. And so when I was younger, a young man or even a teenager, I wouldn't have even considered it because of the insecurity and not associating whatever, you
Yeah.
name it.
Yeah,
I
I
was
know.
absolutely, I was a product of my environment, right?
Yeah.
But I was mature when I entered nursing. I was in my 30s and I did not care about that. I liked the profession, right? I
Yeah.
liked what it was going to enable me to do. And so and also because I was already in my 30s and I had just finished a master's degree that I was no longer going to use, I knew I needed to make some decisions quickly. So when I looked at the career, I actually made a decision to enter a MEPIN program, a master's entry program. So I actually went in and I trained very intensively for 12 months and then took the NCLEX. And in my program, we had 1 week to pass the NCLEX in order to start training as an advanced practice nurse. And it was a great program, and 100% of the people in my cohort passed the NCLEX and entered the second phase of the program. But I'm sorry, that's a long answer, but it was really about being of service. But I'll just say one other thing. I actually declared bankruptcy when I was a teacher. And that was because I had, financed my own education and I
Yeah.
was making a unsustainably low income in a very expensive place to live and
hmm
had lots of college credit card debt and just couldn't balance it all and ended up just being, and also my school district didn't pay me on three separate occasions on time. And so I went, then what happens with credit cards. Now you
Yeah.
missed a payment. Now you're at the top interest
Yeah.
rate. So it was incredibly humiliating and demoralizing. And I knew if I'm going to choose a another helping profession. I have to find a way to make a sustainable living. And
Yeah.
I didn't have any family at the time. I wasn't supporting anyone else but myself, and I still couldn't make it work as a teacher.
Yeah.
So nursing offered me that opportunity, and nurse practicing too.
Yeah, 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 yeah. So when you started this and started telling me that you were a teacher and you got burnt out, and my mind said, so you left teaching because you were burnt out and went to nursing.
I know. I mean, anyone who's listening to this right now who's a nurse knows like that, that's not an easy path,
Not at
right?
all.
I will say this. I made a promise to myself, right? When I was entering nursing, I said, I am not going to let myself get to the place I ended up at as a teacher. And I will say it wasn't just vicarious trauma and chronic stress, it was the financial burden as well. So ever since I became a nurse well, actually, ever since I got my first job as a nurse practitioner, I have not been under that pressure ever again that I was as a teacher. And so that really helped me. But
Mhm.
there's been three occasions during my career where I have actually um, told my employer, I'm cutting my schedule back. Right. And I know
Mhm.
that's really hard when you're a bedside nurse,
Yeah,
to just say, actually, I mean, well, I know some nurses figure out how to do it. They go per diem or whatever, and they figure
yeah,
out how to make it work. But, in the outpatient space, it's really hard as a nurse practitioner to say, no, actually, I'm only going to work 3 days a week. You
hmm,
always have that fear that they're going to say, okay, well, we're going to replace you with
yeah,
someone who's going to work 5 days a week. Right.
hmm, hmm,
Because I worked in behavioral health and because I worked in Medicare, behavioral health and Medicare, there's very few clinicians who embrace that, who embrace like focusing in that space. So I was always in an area of shortage. So
uh-huh,
I had a little bit more leverage, right?
yeah,
And so I was able
yeah,
to say, I'm not going to let this happen to me again. And fortunately, I had leverage and also I had enlightened bosses actually who said, okay, what do you need? You know?
yeah, 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 yeah. That's always a help. That's always a help. But here's a question I have now. Coming to nursing in your 30s as a second career, um, what challenges did that present for you? I know that some of the skills as a teacher easily translated, but what were the challenges for you?
It's a good question. I actually feel like it was, I don't, it wasn't defined by challenges related to my age.
Mm.
I actually think coming in my 30s was a huge boon. I mean, you mentioned already, I already had a lot of transferable
Yeah,
skills. I'd been a business manager and then I was a teacher.
yeah.
Uh, I already spoke Spanish, and in California, that was a huge asset. Um,
Okay.
and then I just had the maturity of like already having been through some hard things. So I would probably characterize it more as I had advantages probably over others, who were starting earlier in life. I mean, become a nurse at 22 years old. I mean, that's a whole different experience. I was 37 when I became a nurse, or sorry, 36. So I was stable. Like I wasn't interested in, I didn't have as much of a pull to like the
Yeah,
social party scene or any of that.
yeah.
I went to bed early. I took care of myself. I didn't burn the candle at both ends, and I had the confidence of maturity, I would say.
Yeah,
And
yeah,
I knew myself better, right? Like
yeah,
I became a nurse in my early 20s, I would have I would have totally failed because I wouldn't know how to take care of myself very well.
yeah. So now that we're talking of taking care of yourself, let's just jump ahead and ask you, what do you do to take care of yourself?
Um, for me, it's all about priorities, right? It's all about like what is most important. Um, but knowing what you can and cannot do, right, is what helps you figure out what's most important, right?
Yeah.
So making sure I get enough sleep is huge. And it's challenging because I have young children, so they wake me up. And then like making sure that I take care of my hydration. I'm very fortunate to not have, chronic health conditions that I
Yeah.
have to contend with. Um, and then being physically active. I am not a gym person, but I am a person that, if I don't, do like 10 kilometers a day, walking, playing with the kids, just going upstairs and not elevators, all those little things,
Yes,
I just feel so much better when I do those little things. And
yeah.
then I'm very connective. Like one of the reasons I went into behavioral health is because I connect and relate to people. So for me, relationships are a really big part of how I take care of myself. So I just make space for friendships, for family relationships, not just my own family, my wife and children, but my extended family, my
Yeah.
mother, my father, my
Hmm.
stepmother, my brother, my sister, my cousins. Um, and now we live at a great remove from them, but
Yeah.
technology facilitates that
Yeah.
communication. um
Yeah.
and not
Yeah.
drinking too much alcohol. But my wife and I absolutely love fine wine, so that is, for me, I consider that a really a health promoting practice in our lives. Is we enjoy it, we
Hmm.
we enjoy sharing it with other people, so there's the social part, you
Yeah.
know and yeah, and I think that's sort of my basis plan. And then I have to be doing something meaningful. Otherwise, I think I would just
Shrivel up here.
yeah, I really I
I know.
feel privileged that I figured out that I wanted to help people when I was really much younger, right? I feel privileged about that because it's guided my decisions, again, priorities, right?
Yeah.
It guided my decisions down a path that led to me being of service, and there's an incredible gratification that I get. I mean, people say, "How can you treat people with complex dementia that don't even know who you are?" Like some of them are nonverbal, they're really
Yeah.
suffering. Like how is that gratifying? Like I cannot cure that illness, but I can totally transform the care journey, right?
Hmm.
For the patient, for the loved ones, for the primary care provider, for the paid caregivers. To me, that's incredibly gratifying. And so I have to do stuff that I love. Otherwise I will probably just become,
I
depressed,
know what.
you know.
Yep, I know what you mean. I know what you mean. And so you're an entrepreneur. You founded Avail Health,
Yeah.
right? And as I understand it, it's a digital health company.
Yes. So it's the digital health. We use that term now, right? In the industry, it's like, well, what does that mean?
Well, it's
It's still,
jungle.
yeah, I mean, it's still humans providing human services to other humans, right? That's the fundamental. The digital part is that we are a remote company, like a virtual,
Hmm.
primarily, not entirely, but primarily virtual. So that means that, we have nurses and nurse practitioners and also licensed clinical social workers, and who are seeing patients through virtual means, by the phone, by video, and that we
Hmm.
focus on behavioral health in Medicare. So, dementia, depression, anxiety. And then
Hmm.
many people may not know this, but if you're a younger adult, but you're chronically disabled by serious chronic mental illness, you will qualify for Medicare when you qualify for permanent disability. So
Hmm.
there's also younger adults in the mix, right, that we're serving as well. Um, and so the digital part is we use technology to assist to connect us to patients. And then we also use some advanced technology to make the job of being a nurse or a nurse practitioner easier. We have like an ambient AI scribe that helps us focus on the patient during the visit and then writes a note that we
Doesn't.
review, and then we also have an artificial intelligence driven interpretation tool so that none of our patients have to have a family member speak for them or have to wait for us to hopefully get someone on a telephone who can
Yeah.
interpret for them.
Mhm.
And so it makes it easier for the patient and the loved one. It makes it easier for the clinician. And then we use a very clever way of connecting patients and having secure communication because our model is longitudinal. Like we're not just seeing you and then we'll see you in 3 or 6 months. We are actually following the patient. We're having contact with the patient sometimes on a weekly basis, sometimes during periods of instability, even more frequently than that. So our
Mhm.
model is about optimizing the wellness of people so they don't need to go to the hospital, right? And so we can serve a lot more people much more broadly if we don't have this brick and mortar clinic model where
Yeah,
the clinic comes to you through your computer or your
yeah,
smartphone or whichever
yeah,
you know
yeah. So how old is Avail Health?
oh, it's a baby.
It's a baby. That's what I
It's
thought. So
yeah.
when
So
Avail Health, you're talking about, technology, integrated into this. So Avail Health is a baby now. When it's about 5 years old, what do you think you have integrated into this technologically wise?
well, um, there are two things that drove the creation of Avail Health, and those issues are not going to go away anytime soon. One of them was because I've worked for 13 years in Medicare, I know that there is a huge gap, multiple gaps in our healthcare system related to behavioral health needs of patients as they age, right?
Hmm.
So I wanted to try to close that gap. And so that's a big part of why Avail Health exists. The second reason, the second problem, if you want to call it that, is that we're experiencing a clinician burnout crisis. And this is people who don't live and breathe healthcare every day may not really be thinking about this that much. But
Right.
if we lose the kind of numbers of registered nurses from the profession is being anticipated, that is desperate. That's desperate for us. And so I wanted to give registered nurses an alternative career path. Like I wanted to create a company that allowed nurses to still be nurses outside of the hospital and also from their home
Yeah,
and
yeah.
that they can set their own hours so they can start when the kids are in school and finish before school is out. Like if that's what
Mhm.
they need to do. And so I've been able to create that by creating a model where nurses own their own private practice and they contract with my organization and we provide them the patients and we manage the practice for them and they just get to focus on patient care, but they're their own boss. They employ themselves. And so we're doing the same thing with nurse practitioners too. It's just the roles are different, right? Like
And
the
different, yeah.
care manager, care navigator, disease education, patient and caregiver education, troubleshooting all the barriers that people face getting
Yeah.
care, right? And getting paid for that. And it's incredibly meaningful to keep people out of the hospital, right? And then the nurse practitioners are virtualists that are, taking care of patients with complex needs from their home office. And the nurses and NPs are actually, sorry, that we're all nurses. The RNs and NPs are actually working in teams, like pods. And we add in licensed clinical social workers for therapy and community health workers to go out if the patient has
Yeah.
trouble accessing our care, people to actually go to the home and in facilitate that. And we also have you talked about technology. We have
Yeah.
a partnership with a technology company that a single tablet that's got a dedicated platform that we're connected to. You can leave that in the home of a patient that's struggling to engage. Many of the most expensive patients in America are not expensive because of their own choices. They're
Yeah.
expensive because healthcare has not been designed to meet
To
their
accommodate.
needs, right? And so we're looking at every way. So that's the answer is technology has two primary purposes in our model. One is to facilitate access to care for underserved populations. And two is to make being a clinician sustainable so we do not train these professionals and make them highly skilled and then create a work environment that they cannot
That is,
survive, right?
yeah, yeah. Awesome. So what would you say though? You started this company and there are lots of RNs, NPs, LPNs or trying to become entrepreneurs, moving into the entrepreneurial space. What do you see as one of the biggest obstacles for a nursepreneur?
Um, well, I'm gonna create two buckets here.
Okay.
One is the nursepreneur who's focusing on healthcare, and the other is the nursepreneur who's focusing on services to other nurses or something outside of like something that's
Yeah,
not
gotcha.
directly related to their nursing scope of practice, right?
Yeah.
So the
Mm-hmm.
ones who want to be an entrepreneur but they really want to bring their genius as a nurse to help solve problems in healthcare, the primary barrier is that it's a very complex system and there's many different players and products that we develop, right? Like whether it's a bedside product for hospital systems or a clinical product like mine that's serving people in the communities, there's many hurdles to get what we
Mm-hmm.
call from 0 to 1. 0 being the start, 1 being now we actually have a product that people are actually using and we're actually
Mm-hmm.
getting paid for it, right?
Uh-huh. Yeah.
So it's getting from 0 to 1, and it means something different depending on what you're building. But ultimately, that is the biggest challenge. How do you do that? Because usually you are not making money during 0 to 1, right?
Mm-hmm.
Now, the way I did it with my first company was I kept working 27 hours a week in 3 days as a clinician for a W-2. And then I built my company when I wasn't
Yeah.
when I wasn't doing that, right? This time the way I did it was I saved a lot of money so that I could go for an extended period of time without earning and also invest in the business, right? Because it's not just
Mm-hmm.
not earning. So one of the reasons that we started Avail was because I had so much trouble going from 0 to 1 in my first company. And then I did it again for someone else. And then I did it again for someone else. And I realized I actually know how to do this now. What if we build a company that actually helps nursepreneurs who want to own their own practice? If as long as they're interested in Medicare, as long as they're interested in what we're doing, we basically allow them to be a nursepreneur. So in our model, in our first group, the nurses who are creating practices are called entrepreneurs in residence because we are
Okay.
essentially helping them learn and they'll know this for the rest of their careers, right? Like
Yes. Yes.
these are all the things we have to jump through. So that's the answer for like clinical nursepreneurs, right? But then there's a whole other set of amazing, innovative
Yeah.
nurses,
Yeah.
like who are creating all different kinds of things. And to those nurses who they're like, I want to be an entrepreneur, but I don't want to do clinical work, right?
Mm-hmm.
Some of the challenges are the same, right? The 0 to 1 problem.
Mm-hmm.
But the best piece of advice I can give to any nurse who wants to create a business is learn how to create an investable and sellable business. So, because when you have a business that someone might want to invest in, then you have what a kind of currency, which is called equity, right?
Yes.
Equity is a piece of the business. Now, if you have an investable and sellable business idea, even at the beginning, it's just an idea. You can now do two things that really help you. One, you can form an advisory board. And what you do is you offer people who are expert in things you're not expert in, but you need expertise to be able to realize your business idea. You offer for a small amount of their time on a monthly basis for an extended period of time, you will give them a piece of the company. You don't have to pay them.
Right.
Right?
Right.
So you can't do that if it's not an investable business. Like nobody's going to take equity in something that you can't sell,
You can't sell. Yeah.
right? So that's the one part of the investable sellable business. The second part is you can raise money, right? So now you've got people that will help you for equity only. And now you've got people who will give you money to be able to realize your dream. That is not as easy as it sounds, but it is. That's the difference between my first business and this business. Is I figured out how to create an investable and sellable business to build an advisory panel of amazing experts, and then also to then seek funding, which I have not yet succeeded in attaining, but to seek funding to let the business really grow, right? So we have revenue, we're providing care, but to scale it,
To scale it.
to grow it, to serve, tens of thousands or hundreds of thousands of lives. There are, 6 million Americans with dementia,
Literally,
right?
right.
And so to be able to do that, we need to get into a relationship with either a very high wealth person or an organization designed to invest money in businesses in order to create more wealth.
Yeah. Yeah, yeah, yeah. Wow, that's a huge project. That's a huge project, Joe.
I like hard things.
Apparently, it can be done. It can be done.
Yeah, and
It
that's
can be done.
the reason I emphasize that create an investable and sellable business is because I did it on my own the first time, and it was truly testing me, and in a way that felt really hard, in a way
Yeah.
that I was like, oh my gosh, I never want to go through this again, and so I'm like, well, if I can prevent that for other people, I'm doing it all over again. I am doing it again, but I'm doing it so that it spares a lot of other people from having to do it.
Okay. So that's that helping people nurse side of you coming out all over
Of
again.
course. Of course. I have an advisor. I have an advisor who's also a nurse. And he reminds me, he says, Joe, you're also a CEO. So you can't wear your nursing hat when you're in your CEO
Your
role.
chair.
You have to be able to do both, right? And it was great to get that advice because, I mean, I'm not this way because I'm a nurse. I'm a nurse because I'm this
I'm
way,
this way. Hmm.
right?
Hmm. Yeah.
So yeah, it's great. You'll never grow. I mean, I grow so much, right, doing what I'm doing. But if we can like minimize the pain for other people, they can still grow without as much pain.
I got it. I got it. I got it. I have one more question, Joe.
Yeah.
If you could tell me, I'm collecting these words, and if you could tell me in one word what you see as the most essential quality of a nurse, what would that word be?
Empathy.
Empathy. Comes up a bit. Yeah. Yeah. I think I started asking that question, I think, because certainly for me, when I got into nursing, it never occurred to me to wonder what real qualities do I need to have? What do I need to have? And then I started realizing as I became more and more seasoned in the profession, I started realizing that I could recognize other nurses without anyone telling me they were a nurse. And I started thinking, what am I seeing? And do I see the same thing in me?
Yeah.
So,
Yeah. I agree. And I think, that is a really challenging question you ask, right? It's because I want to say five things, right? But you give me one, right? So, but for me, the reason I think I chose empathy is because empathy and not doesn't just enable us to understand and anticipate the needs of our patients. It also enables us to do that for our colleagues, right?
yeah, yeah,
And for the other stakeholders, right? And sometimes our jobs are so much harder because of the people next to us, not the ones in front of us, right? And so that's something we also have to solve
yeah,
is in Avail Health, one of the things I'm really excited about is we are building this model keeping in mind vicarious trauma, right, that we experience as nurses, witnessing people go through the hardest moments of their life and also their life ending, right? And also like horizontal violence, right? Like the way that we can be harmed by our colleagues, our peers,
Mhm,
either directly with intention or
mhm,
indirectly by
mhm, mhm.
omission or by neglect or whatever it may
What?
be. And then the other term that's really important to me is moral injury, right? And that's that feeling that you get when you know I've just kept this person alive for 4 days and brought them back from the brink, and now they're going to be discharged and no one's going to be watching out for them, and they're going to
Mhm.
end up coming back
It's
here,
right back.
or never making it back here, right? Like, or I know what this person needs, but I'm being forced to like facilitate an early discharge, and that's not what's best for them. And
Yeah.
that injury of like I don't have control over the levers to really change
Mhm,
things for people, right? So vicarious trauma, burnout, moral injury, like we are designing what we're designing to say, we do not want to reproduce that. We want to, by intention, prevent that in our model. And how do we do that? We do that by making the job easier. We do that by having incredibly robust resources to really provide the services that people need. We do that also by addressing the heart of nurses, right? So group therapy, um,
mhm,
skill development for coping with stress,
mhm, mhm.
and those kind of things. Like that has to be in our model. Otherwise, a nurse that's burning out at the hospital is just going to burn out at Avail Health too. Like
Yeah,
it's hard
yeah,
work. Like it's
yeah.
not easy when you go to outpatient, but it's a different kind of work, and we just want to make it sustainable, right? And I know a lot of people are working on that in hospitals too, but uh, you know, it's that's not my space. My space is
This
outpatient
is.
space.
Mhm, 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 mhm. Joe, I cannot even begin to tell you how much I have enjoyed this conversation.
Good.
I thank you so, so very, very much for doing this. It's been an absolute pleasure on my part. Any last words you want to leave us with?
I would just say I want to thank you. I thank you for I love the model of opening up a conversation and having a global consciousness, right? Because
Mhm,
I'm talking about the challenges that people in the United States face,
mhm.
because that's what I know well. But that's not the only place where nurses are doing,
That's great
essential
things.
work, right?
Mhm.
And also nurses in other places face obstacles that we may not be facing ourselves, and
Yeah,
have like legal or regulatory environments
yeah,
and socioeconomic environments and
yeah,
environmental conditions that are remarkably challenging to be in. And
yeah,
I have deep respect and appreciation, for
yeah,
that, to what I understand it to be. And I thank you for giving voice to that too, right? That you can have an audience that crosses borders and opens
yeah.
up minds and our hearts to other experiences, and also inspiring stories, of course.
Yes, indeed. I have learned so much from so many people. Yes, indeed. Yes, indeed. Thank you so, so much, Joe. It has
Thank
been a
you.
great pleasure.
Thank you. Let's stay in touch.
Yes, we will.